Hello and welcome to our Lunch and Learn presentation regarding the new urgent care benefits available to employees here at Hunterdon. We're glad that you're listening to this and hope that you'll get some great information by listening to the program. For those of you who don't recognize my voice, this is Tony, or Antoinette Rice. I work in the Human Resources Department. I'm the coordinator for employee benefits. My email address is arice@hhsnj.org. My direct extension here at the hospital is 908-788-6133. So please feel free to email me, to call me, to reach out to me in any way. I look forward to hearing from you. So let's talk a little bit about when you want to use the urgent care. Generally speaking, if you are having a non-threatening medical condition that you need assistance with, the first choice is to go to your primary care physician, right? So hopefully all of us have a primary care physician. If you do not, I'm happy to help you find one. There's lots of information on the hospital's intranet about the PCPs that we have here at Hunterdon. Ask your colleagues. Employees and your colleagues will love to tell you about their docs and their relationships with them and make a recommendation, I'm sure. So having a primary care physician, you want to go there first in the instance of a non-threatening condition that you're dealing with. However, sometimes you can't get to the primary care physician. That's when you want to think about maybe using the urgent care center. If it's not a life-threatening situation and you can't get to your primary care physician, the urgent care center is where you could potentially go next. However, if you have a life-threatening situation going on, or this is a real emergency, of course, you want to just go straight to the emergency room. So the new urgent care center that we've opened in Flemington is located on Church Street. So Church Street is south on 31, going towards the circle, away from the hospital, and it's in the area close to the Wawa, kind of catty corner to Walgreens. So it's some people refer to it as the old Reebok building, but it's beautiful. It's been redesigned, and the layout is fabulous. So people really enjoy going to see it. If you haven't seen it, hop over and take a look. They're open from Monday to Friday, 8 a.m. to 8 p.m., so there's your extended hours during the week, and then they're also open Saturday and Sunday from 8 a.m. to 6 p.m. So this gives people an opportunity to get to the care that they need outside of their primary care doctor's office late at night during the week, and then also extended hours on the weekends as well. If you need to reach them directly, you can call them at 908-237-4036. You can also go to their website at thehunterdonurgentcare.com. You can schedule an appointment there as well if you choose to. You do not have to, but you do have the option to schedule an appointment if you know that you're going to go in. So here are some examples of what would be considered non-life-threatening conditions, right? These are some of the things that you might go to the urgent care for when you're not able to get to your primary care physician. Bad cold, high temperature, maybe a child that's really sick and they're running a high temp. Flu, pneumonia, if you think you're coming down with something like this. Urinary tract infections, something they see quite often. Conjunctivitis, minor injuries, burns, cuts, things like that, fractures. They're able to address those issues. Again, immediate care. What can they address for you right there and then? Bring you in, resolve the issue, get you home, and then refer you to where you may need to go for some follow-up care. Animal bites, same thing. You get some insects, you get a really bad stings or something, you need some relief right away, and they can address it there for you right there and then. If you have a deadline for a physical, for sports, for camp, something like that, and you're not going to be able to get into the primary care doctor's office, by the deadline, here's another option for you. However, I will caution you about a few things. If you think that you've been bit by a tick and you need a test for Lyme, if you go to the urgent care, they're probably going to refer you back to your primary care physician because Lyme is not something that they can address in one visit. It's going to require follow-up care. So if you come in for a Lyme test, they're going to refer you to your primary care doctor's office. Okay? If you have chest pain and you think that it's related to a cardiac situation, they're probably going to refer you to the emergency room. All right, so again, maybe more high level, you might need to be in the emergency room. If you come in with abdominal pain, severe abdominal pain, they may want an ultrasound. You may need blood work. They'll probably refer you to the emergency room in that situation as well. So just kind of be mindful of what you're coming to the urgent care for. You want to think about something that's non-life-threatening that they can address for you start to finish pretty much in that visit. Okay, so Lyme's disease, again, not something that they can do for you in one visit. You're going to need follow-up care. Somebody's going to have to report the results. Again, cardiac, that's life-threatening, right? So you probably want to start to potentially at the emergency room. Okay? So here we're talking about what does it cost on our plans to use the urgent care. So if you are enrolled in Hunterdon's medical plan, so we're talking specifically about the hospital's HMO plan or the hospital's high deductible plan for yourself or your dependents that are enrolled in those plans, if you're using Hunterdon's urgent care, it's going to cost a flat fee of $210. So regardless of what's done in that visit, it's $210. If you have any blood work done, if you have a radiology service, the emergency room physicians that are there, all of it's going to cost $210. You're not going to be billed separately for anything. Okay? This applies to anybody on our medical plans. So if you're going to our urgent care and somebody in your family has a different insurance plan, this may not apply. So this only applies, what we're talking about today is people that are using our hospital plans and what the cost would be to them or to their dependents on our plans. So on this slide, we're talking about what's the difference in terms of cost to go to the primary care versus the urgent care versus the emergency room. If you're going to a primary care office visit in the HMO plan, you're going to pay your copay, right? The copay for a Hunterdon primary care physician's office visit is $20. If you're going to a primary care doctor's office outside of the Hunterdon network, it's $25. So HMO plan is going to run you between $20 and $25 to go visit your primary care office for a visit. If you have the high deductible plan, if you go to your primary care doctor's office, you're going to pay whatever the contracted rate or the cost of a visit is. It's not a copay. So generally speaking, diagnosis-specific kind of office visit's going to run you $110 in the high deductible plan. Could be a little bit more, could be a little bit less, depending upon what they were doing, but roughly on average $110 for an office visit in the high deductible plan. If you choose to use the urgent care, both plans are the same. It's $210 if you're using your HMO plan, $210 if you're using the high deductible plan. So $210 is applied to your deductible. Now, in both plans, if your deductible has been met, you'd be responsible for 10%. So if your deductible is met and you go to the urgent care, you're going to pay 10%. 10% of $210 would be $21. So now it's $21. If you go and you have met your out-of-pocket maximum for the year, it would be $0 of both plans. So they both function the same. So the cost of an urgent care visit is $210. If your deductible is not met yet, you're going to pay the $210 being applied to your deductible. If your deductible has been met, you're going to pay 10% or $21. And if your out-of-pocket was met for the year already when you have this visit, then you would pay nothing because your out-of-pocket has been met. There's no coinsurance, there's no deductible remaining, so you would pay $0. Not even a copay. If you're going to the emergency room, this is where you really want to be aware of the difference in the costs, right? The emergency room is about $1,200 on average for somebody that's in the HMO plan, $2,000 on average for a visit for somebody that's in the high deductible plan. Again, assuming you haven't met your deductibles, $1,200 for the HMO, $2,000 for the high deductible plan. If you've met your deductible, you'd be paying 10% of those costs. If you've met your out-of-pocket maximums, you'd be paying nothing for those things, same as the urgent care. It's just that original cost, $1,200 for the HMO, $2,000 for the high deductible. The other thing to keep in mind with an emergency room visit is that there are additional services being billed. You'll get a bill from the emergency room. You'll get a bill from the emergency room physicians. If a specialist came to see you, you might get a bill from the specialist. If a X-ray was taken, for example, You might get a bill from the Hunterdon Radiological Associate Group for reading an x-ray that was taken in the emergency room. So when you go to the emergency room, you can generate additional bills. Some additional benefits to using our Hunterdon Urgent Care Center include access to medical records. Hunterdon's Urgent Care is part of the Hunterdon Healthcare Network. If you have other providers within the Hunterdon Healthcare Network as well, they have access to the records for anyone in the Hunterdon Healthcare Network. So that's an opportunity for them to provide you with a higher level of care because they have access to those records. Again, the flat $210 fee is for our employees and their dependents enrolled in our medical plans. That flat fee is a benefit to our employees using our urgent care center. You have access to emergency care professionals. The same emergency care professionals that are in our emergency room are also the professionals that are available to you in our urgent care. And again, no appointments needed. Walk-ins are always welcome. So something else that has changed is that our occupational health department is now located primarily in the new urgent care center that's located at the 63 Church Street address. So the main location for occupational health is in the urgent care center. We do still have an office on the first floor of the hospital where it's been for a very long time. They do have, you still have access to care for occupational health there, but the primary location is now at the urgent care center on Church Street. So Monday through Friday, you can get to the occupational health department at the new location. However, Monday through Friday, we do have occupational health on the first floor from 7 o'clock in the morning until noon. And this has been happening since September, so people are kind of falling into their routines. But you can still reach the occupational health department at the same contact numbers. 788-6146 will take you to the main location, which is now in the Church Street building. However, you can make appointments for either place by calling that number. And you can fax information, again, to the same fax number, 788-6698 is where you send the information, and they'll get the information to wherever it is you're going or wherever it needs to be. So some of the questions we've gotten regarding the new location for occupational health is, what do I do if I don't feel well? Well, I mean, people can make the determination if they should come into work. If you don't feel well, the first choice is stay home. If you come to work and you start to not feel well or it gets worse, then you should go home. So you can call your PCP, you can make arrangements to see your primary care doc that day if you think you need to, if you just don't feel well. Or if it's really a serious life-threatening sort of a thing, of course you're going to go to the emergency room. But if you're just not feeling well from a general perspective, you can stay home, you can go home, or you can call your primary care doc. It's not really necessary to go to the occupational health department for something that's not work-related, right? Now, what if it is work-related, right? This isn't just I don't feel well. This is I've pulled my back out, or this, working, lifting a patient, or I've fallen, during the middle of my work day, something like that. That process really hasn't changed. If you've injured yourself, you're going to, tell your manager that you've injured yourself. Then you would contact the occupational health services. If you need to, you can go over to the Church Street address. If the occupational health department is open, between the 7 and noon, and that's when this is happening, of course you can go to the occupational health department on the first floor. And as always, you may, if it's life-threatening or if it's a significant injury that needs to be seen to right then after hours, you can go to the emergency room. That really hasn't changed. The only thing that's really changed is that after 12 o'clock noon, if you injured yourself, you may need to go over to the Church Street address. Another common question is about return to work appointments. If you're somebody that's been out on a leave of absence and you need to come through the occupational health department to return to work, you'll need to make your appointment and go to the Church Street location. So that's where the return to work appointments will be happening. And remember, you want to do that at least 24 hours ahead of time. The reason we ask that you do this at least 24 hours, maybe even 48 would be better, is because everything has to be reinstated for you. You need access to your email again. You need to be able to get into Kronos. You need to be able to get into any of the hospital systems that you use in your area. So that 24 hours allows us to ensure that everything's turned back on for you so that when you actually physically report to work, all those systems are back on. Phase 1s and Phase 2s for new hires, those are also being done at the Church Street location. People are very positive about the new location. I've spoken to some of the employees as they're coming through orientation. They like that it's easy to get to. They like the parking is easy, the beautiful layout, the building, the facility is beautiful. So a lot of positive feedback from new hires, and the physicals are being done at the Church Street location. Respiratory fit testing, annual health reassessments, your choice. If you're on main campus here at the hospital, you'll probably want to make an appointment to go downstairs. If you want to have it done between 7 and 12, it's convenient. You can go to the location on Corridor B on the first floor, or you could choose to go to the Church Street location. Many of our employees don't work at the hospital, so they're using the Church Street location. You can choose either, whichever is going to be more convenient for you. So here's a couple more questions regarding the new occupational health location. Commit to be fit cards, are they still available? Yes, they are available in the hospital location on the first floor, Corridor B. If you'd like to get your Commit to be fit card renewed, you can go there. Flu vaccines, hopefully today, by now, everybody's gotten their flu vaccine. However, if you haven't, you can always call the Occupational Health Department if you're returning to work, something like that. You can reach out to the Occupational Health Department and they will make arrangements for you to have your flu vaccine. If you need Band-Aids, if you need ice or aspirin, I mean, generally those things are available in the pharmacy. I mean, a lot of people just keep that stuff in their office. I know I have a little drawer with those kinds of things. Ice is always available downstairs on the first floor in the cafeteria. There's an ice machine located in the back. So I would say kind of ask around. Most people have some of this stuff in their areas. So we're going to end our presentation with a general reminder about the Wellness Rewards program. The deadline to submit anything for points, for cash, is December 1st of 2016. So you can submit anything that you've had done between December 1st of 15 through December 1st of 2016. It will count. You just have to submit it by the December 1st date of 2016. Again, want to get your 100 activity points in by December 1st to qualify for the $200 cash in 2016 and the $600 in premium reductions over the year in 2017. For today, after you complete this program, you've listened to it, there's questions that you take at the end, and when you answer those 3 questions, they will recognize it in the system, and then you will see those points automatically added to your progress bar or to your checklist. Okay, so good luck. I hope everybody's getting their points in. It would be great for everybody to get this benefit of the $800. If you have any questions, please don't hesitate to call. Again, my direct extension is 6133. My email is arice@hhsnj.org. Thank you.